If someone told you there was one single exercise, not 5, not 10, just one, that could do more for your leg circulation than every walk you have taken this year combined, would you believe them? Most people wouldn't, and I understand why. Because we have all been told the same thing for so long that it feels like a law of nature. Walk more, move more, get your steps in. And I want to say clearly right at the start that walking is good for you. And I am never going to tell you to stop. But walking was never designed to fix the specific problem that is happening in your lower legs right now. And once you understand why, you are going to see this whole issue completely differently. I'm Dr. Sarah Bennett, and for years I've sat across from patients in their 60s, 70s, and 80s who did everything they were told. They walked their dog every morning. They elevated their legs at night exactly like their doctor said. They bought the compression socks, wore them faithfully, and still their ankles puffed up by 4 in the afternoon, their feet turned cold the second they sat down for dinner, and some of them told me quietly, almost embarrassed to admit it, that they had started avoiding stairs because their legs simply felt heavy and wrong. They were not lazy. They were not doing anything incorrectly. They were missing one piece of the puzzle that almost nobody ever explains properly. And that is exactly what I want to give you today. Here is why this actually matters, beyond just comfort. When circulation in the legs slows down after 60, it is not a small cosmetic issue you learn to live with. It changes how your body heals. A tiny scrape on your shin that would have closed up in a week at 40 can take a month, or worse, to close up now. And if it does not close properly, it can become a real medical problem, sometimes serious enough to threaten a limb. Poor leg circulation is also frequently one of the very first signs that the blood vessels throughout your entire body, including the ones feeding your heart, are under more strain than they should be. Doctors estimate that by the time people reach their 70s, roughly 1 in 5 is dealing with some degree of narrowed arteries in the legs, and the overwhelming majority of them have no idea it is happening. So before you assume this video is just another rehash of advice you already know, stay with me for the next few minutes, because the fix I am about to show you has almost nothing to do with how many steps you log in a day, and almost everything to do with one muscle you have probably never once thought about on purpose. That muscle is your calf. Not your thigh, not your hip, your calf. Physiologists sometimes call it your second heart. And that is not a poetic exaggeration. It is a fairly literal description of what it does. Every single time your calf muscle contracts, it squeezes the deep veins buried inside your lower leg. And that squeeze physically pushes blood upward against gravity back toward your chest and heart. Inside those veins are tiny one-way valves that snap shut behind each push, which stops the blood from sliding right back down to your ankle the moment the muscle relaxes. That mechanism, contract, squeeze, push, valve closes, is the entire engine behind healthy leg circulation. Most people never had to think about it when they were younger because the system simply worked quietly in the background every time they moved. But after 60, a few things start to change, and none of them are your fault. The walls of those veins get thinner and looser with age. The tiny valves inside them start to leak a little, which means some blood slips backward instead of staying pushed up. And the calf muscle itself, especially in people who sit for a large part of the day, which is nearly all of us now, gradually loses strength and size. When that happens, the pump gets weaker, blood pools lower in the leg, swelling creeps in, the skin down there runs a little short on oxygen, and the less that area moves, the weaker the pump becomes. It is a slow, quiet spiral, and a lot of people are somewhere inside it without ever realizing there was a name for what they were feeling. Now, here is the part I actually want you to walk away remembering. Fixing this pump does not require a gym membership, special equipment, or hours out of your day. It comes down to doing one very specific movement correctly, consistently, and with the right technique. Because technique is where almost everyone gets this wrong without knowing it. I'm going to show you exactly how to do it, how to build it up safely over the coming weeks, and the small details that separate a version that barely helps from a version that genuinely retrains your circulation. And before I get into it, I want to mention something briefly because it matters to me that you know it exists. Everything I am walking you through today is one small piece of a larger, simple plan I put together for my own patients, covering the daily habits that quietly decide whether someone is still walking confidently at 80 or struggling with a cane at 70. It has already helped a great number of people feel steadier and stronger in their own bodies. If you want it, there is a link right on your screen, and you do not need to write a single thing down. Before I show you the movement itself, let me tell you about a patient I will call Frank, who is really a composite of several people I have cared for over the years, so that no one's privacy is ever a concern. Frank was 68, a retired electrician, the kind of man who prided himself on staying active. He mowed his own lawn, he still fixed things around the house, and he walked 2 miles most mornings with his wife. But by early evening, his legs would feel heavy and tight, almost like they were wrapped in something, and his ankles had started leaving a visible sock line that lasted for hours after he took them off. He told me he felt almost insulted by his own body because he was doing everything right, and it still was not working. Keep Frank in mind as we go, because what eventually changed things for him is exactly what I am about to teach you. Let's talk for a moment about why walking on its own does not fully activate this pump the way people assume it does. When you walk, your calf muscle does contract, but only briefly, in a quick rolling motion as your foot pushes off the ground, and then your weight shifts forward before that muscle ever gets the chance to fully squeeze and hold. It is a partial contraction over and over, momentum carrying you along rather than the muscle doing sustained, deliberate work. That is enough to keep things ticking over in a young, healthy leg. But after 60, with weaker vein walls and leaky valves, a partial squeeze repeated quickly is simply not enough force to reliably drive blood all the way back up and keep it there. What actually moves the needle is a contraction that is slow, deliberate, and held at the peak long enough for that pump to fully close down and clear the pooling blood out of your ankles. That is the entire secret, and it is almost never explained to people in plain language. So here is the one exercise, and I want you to listen closely because the way you perform it changes everything about how effective it is. It is called the standing calf pump hold, and physically, it looks almost identical to a basic calf raise, which is exactly why so many people dismiss it as something they have already tried. The difference that changes everything is the hold at the top, and almost nobody does that part. Here's exactly how to do it. Stand behind a sturdy chair or at your kitchen counter and rest both hands lightly on it for balance, not for support, just enough contact to steady yourself. Place your feet about hip width apart. Slowly rise up onto the balls of your feet, lifting your heels as high as feels comfortable for you. No need to force it higher than your body wants to go. Once you reach the top, this is the part that matters most, hold that position for a full 3 to 5 seconds. Keep breathing normally the entire time. Do not hold your breath, and keep your eyes looking forward rather than down at your feet, because looking down subtly throws off your balance more than people expect. After the hold, lower yourself back down slowly, taking a full 3 seconds to return to the floor, resisting the urge to just drop your heels quickly. That slow, controlled descent is doing real work too, because it keeps the muscle under tension the entire way down instead of letting gravity do the job for you. That entire sequence, up, hold, slow down, is 1 repetition. If you are just starting out, aim for 8 repetitions. That is genuinely enough for your first few sessions. As your calves adapt over the coming week or two, work your way up toward 12 to 15 repetitions. And eventually, if it still feels manageable, up to 20. You can do 1 set in the morning and 1 set in the evening. And that alone, roughly 3 to 4 minutes total across your entire day, is enough to meaningfully retrain this pump over time. The hold is what separates this from an ordinary calf raise you might have done in a gym class decades ago. Without the hold, your calf contracts and releases quickly, similar to what happens during walking, and you get only a fraction of the benefit. With the hold, You are forcing that muscle to stay fully squeezed long enough for it to genuinely clear out the blood that has been sitting stagnant around your ankles and drive it upward toward your heart, the same way it was designed to when you were younger and moved more throughout the day without thinking about it. I want to give you a sense of why this particular movement is trusted the way it is, because I never want you to take my word for something without a reason behind it. In a clinical study published in the Journal of Vascular Surgery, patients dealing with genuinely poor circulation in their legs took part in a simple, structured calf raise program. Nothing fancy, no equipment, no medication involved. After several weeks, their pain-free walking distance improved significantly, and their total walking distance before discomfort set in increased by nearly 100 meters on average. That is not a small effect. That is a muscle doing exactly the job it was built to do once it is asked to do it properly. Physical therapists who specialize in vascular rehabilitation lean on this exact movement more than almost any other tool available to them, precisely because it requires nothing except a person's own body weight and a few minutes of patience. Now, I know some of you listening are wondering whether this is safe if you have arthritis in your knees, or if your balance is not what it used to be, or if you have had a hip replaced. In most cases, yes, this movement is appropriate, precisely because there is no jumping, no pounding, and no sudden movement anywhere in it. Keeping your hands lightly on that chair or counter gives you a stable anchor the entire time. So even people with genuinely shaky balance can perform this safely, as long as they respect that support and do not try to rush the movement without it. If you have any concerns specific to your own health history, it is always worth a quick conversation with your own doctor before starting anything new, and I would rather you take that extra step than skip it. As this movement starts to feel easier over the coming weeks, there are two ways to progress it, and I want you to know about both so you are not stuck doing the exact same thing forever with no sense of growth. The first is to shift your support. Instead of resting both hands fully on the chair, let your fingertips rest there just lightly enough to catch yourself if you wobble, without actually bearing any real weight through your arms. This forces your ankle, your calf, and the muscles around your hip to work together to keep you steady, which adds a genuine balance training element on top of the circulation benefit. And balance, as it turns out, is deeply connected to how well your circulation functions, because the more confidently you move throughout your day, the more often that pump gets engaged naturally. The second progression is to try it on one leg at a time. Once you feel genuinely steady doing it on both, standing on a single leg and performing the same slow rise, hold, and controlled lowering asks significantly more of that calf, and it dramatically increases how much that pump has to work to keep you upright and moving blood at the same time. You do not need to rush toward that version. Some people take a few weeks to get there, some take a couple of months, and that is completely fine. The goal was never speed. It was consistency. Let me come back to Frank for a moment, because this is where it actually landed for him. I had him stop worrying about his walking distance entirely for a few weeks and focus only on this one movement twice a day, exactly as I described it. Morning, while his coffee brewed, and evening right before he sat down to watch the news. I told him honestly that I could not promise him instant results, and I never do that with any patient, because it would not be true. But within about 3 weeks, he came back and told me something that stuck with me. He said his ankles were not leaving that sock line by dinner anymore, and his legs did not have that tight, heavy feeling by the time he sat down at night. He still walked his 2 miles most mornings because I never told him to stop, but he finally understood that the walking and this one exercise were doing two completely different jobs, and he needed both, not just one. Before I let you go, I want to give you an honest word of caution, because I would always rather you be overly careful than not careful enough. If you ever experience sudden severe pain in one leg, or a leg that turns pale, cold, and numb without an obvious reason, or a sore on your foot or ankle that simply refuses to heal over several weeks, please do not try to exercise your way through that at home. That combination of symptoms can point toward a genuinely blocked artery, and that is something that needs to be evaluated quickly by a doctor, not managed with a movement routine. Everything I have shared with you today is meant for the slow, everyday kind of poor circulation that builds up quietly over the years, not for a sudden serious event like that. So let's bring this together. The exercise is the standing calf pump hold. Rise slowly onto the balls of your feet behind a sturdy chair or counter. Hold at the very top for 3 to 5 seconds, breathing normally the entire time. Lower yourself back down slowly over a full 3 seconds. That is 1 repetition. And 8 to 20 of them, once or twice a day, is genuinely enough to start retraining a pump that has been quietly slowing down for years. Keep walking, by the way. I meant that at the start, and I mean it now. Walking is wonderful for your heart, your mood, and your joints, and I never want you to give it up. But walking alone was never designed to fully activate this particular pump, and now you know exactly what will. Your circulation is one of the few things about getting older that you genuinely still have a say in. It is not fixed, it is not out of your hands, and it does not require anything complicated to start improving. It requires about 3 or 4 minutes a day, done with attention rather than rush through, and a little patience while your body catches up to the effort you are putting in. If this helped you today, go ahead and subscribe so more of these find their way to you. Give this video a like, and let me know in the comments whether you are starting this one in the morning or the evening. I genuinely read every comment that comes in. Take good care of those legs. They have carried you this far, and with a few honest minutes a day, they are going to carry you a good deal further. I'm Dr.